All right, time now for our Health Watch with Dr. Syed Hussain from Trinity Health of New England. Doctor, good to see you again. How are you?
Likewise, Tim. I'm great, thank you.
All right, got two things to talk about this morning. Brain rot, which we'll get to in a second, but we're going to start with HPV testing because of a new draft recommendation from the U.S. Preventative Services Task Force, which emphasized HPV testing as a primary screening test for women aged 30 and up. I guess this is versus getting a traditional pap smear. So why don't you just talk by taking us through the differences between HPV testing and pap smears with regards to cervical cancer?
Sure, and before that, let's take a step back. So HPV is a large group of viruses, about 150. Human papillomavirus. Most of them cause low-risk disease that's self-limited, Tim, may cause warts, for instance. But there are some strains that can lead to cancer, whether it's anal cancer, cervical cancer, penile cancer, and that's why it's important. We're talking about cervical cancer screening here. So what's the difference between these two tests? Pap smear has been around for a very long time. The recommendations include every 3 years, women from the age of 21 get a pap smear, which is basically a sample from the cervix that looks at any cells that are precancerous or cancerous. Yes, abnormal cells. HPV testing, on the other hand, looks at a vaginal smear collection and testing for high-risk human papillomavirus strains. So it goes a step before the actual, you start seeing the changes in the cells. Yeah, exactly.
So instead of looking for the disease, it's looking for the virus that could eventually cause the disease.
And can be monitored. Those patients can be monitored to see, can be retested in a short time frame. So these are recommendations that are part of the new draft recommendations from the United States Preventive Services Task Force. They are now open for public comment and may be finalized early next year. This comes on the heels of a new test that was approved by the FDA, which actually allows women to collect specimens at home. Two tests that were approved. So let's see how this all evolves. It does actually correlate well with the American Cancer Society guidelines, which also recommend HPV testing every 5 years from the age. USPSTF draft recommendations say from the age 30 to 65.
What is behind, and this is the last question on this before we get to the brain rot, what is behind that age delineation between who should get what tests?
So after the age of 65, as long as you've had at least 3 negative tests, pap smears, or 2 negative HPV, the risk of you getting cervical cancer is very low. 30 to 65 is the prime age group where you would see cervical cancer, hence those age recommendations for screening.
Got it. Okay, on to brain rot, which was one of the dictionaries like to do sort of like the terms of the year, and that was one of them because people are using it more. I'm guessing it's not a medical term, but are there any medical sort of phenomena that it would be used to describe accurately?
So let's describe what it actually means. So it's basically this mental deterioration, if you will, Tim, from this preoccupation of social media, online content, low quality online content, which can lead to, memory issues, just the ability to concentrate. Your imagination is a little bit stunted. All these things that we're seeing, doom scrolling we spoke about a little while back, where there's a preoccupation with just negative news feed, and can all lead to just feeling in a bit of a rut. For the lack of a better term.
Okay, so I think we all have a basic idea of what it is, and I'm guessing we probably know what the symptoms are to be looking for to show that it's a problem, because it is to some degree something I think most all of us do.
Absolutely, especially young folks, especially teenagers, where there's TikTok and all these other social media apps where they're basically glued to them. And it's important that we've spoken about how folks need to have a bit of awareness around this, and then what steps can we take to limit the social media preoccupation, and that includes setting time limits, making sure we go back to things that would interest us and exploring those interests, whether it's reading a book, going to the gym, talking to a friend, calling your grandma, FaceTiming your grandma or family during the holiday, all those things that can take you away from this preoccupation with online content.
Curious follow-up question. What about some online remedies? We're starting to see small, quick games, brain puzzles, Sudoku. New York Times is starting to have a lot more of those, too, that you could sort of do in a couple of minutes. Are those helpful?
They are. Anything that involves creativity or thinking or going the extra step, except in place of just taking it all in, which is, again, low quality, usually social media content.
Low quality. I like that. That's a good way to put it. As always, high quality information coming from Dr. Syed Hussain from Trinity Health of New England. Good to see you again.
Likewise, Tim. Thank you. Happy holidays.